Sorry to interrupt your regularly scheduled programming with Grey's Anatomy, where you get most of your healthcare information, to bring you an important update on the coronavirus that's sweeping the nation. I'm Dr. Cherry Potter, and this is How to Thrive and Stay Alive. What is this coronavirus that we speak of? As a healthcare professional, I have been scouring hospitals across the lower tri-level area. Of course, that means Oklahoma's, Minnesota's, and Texas. Numerous facilities are hiding the cure to this deadly virus. I just got back from Costco. I waited in line for 17 hours to get 2 bottles and a pair of gloves to protect my family, and I'm here to provide this information to you to protect you. What is the coronavirus, you ask? Well, this virus, it has some scary effects. Thousands of people across the nation have been affected by this. Let's go to the World Health Organization to see what they're saying about this virus. What are some symptoms? The common symptoms: fever, tiredness, and a dry cough. Not today, coronavirus. Not on my watch. Some patients might even feel aches and pains, congestion, a runny nose, and diarrhea. These symptoms are mild and come on gradually. Some people that have been infected by this coronavirus, up to 80% of them, don't even develop any symptoms. And they don't need special treatment. Are you kidding me, world? World Health Organization of what? That's exactly what I said. That's what I said. So you know what? I'm going to give you Dr. Cherry Potter's tips to survive the coronavirus. Step 1, be awesome. All right? I do that every day, and you can do that too, America. Step 2, get yourself a health kit. Now, you might feel that this looks like a children's toy, but it is not, America. This is called safety. If I need to listen to something or take my son's temperature, I use this. And it's stylish. Secondly, if you don't own at least 3 bottles of this right now, you're practically dead. I carry this in my pocket everywhere I go. Is it comfortable? No, but you know what? I'd rather be safe than comfortable, America. Third thing you need to get, guess what? Boom, Clorox wipes. I got the yellow and the green 3-pack. I wipe with these now. It says no skin contact. I know that's just them trying to get me to get corona. Not on this day. I haven't showered in 3 days. I've wiped myself down with these like a French horse bath. And guess what? Healthy as can be. Step 4, get yourself a pair of non-latex gloves. I've worn these. I do 1 pair a day, keeps the doctor away. Now this one's gonna get a lot of you, okay? And this was big for me. But you know what? In the name of health, in the name of protecting you, America, I bring you one of the biggest things. Coronavirus, not on my watch. I got a shark protecting my hiney. That's right. I haven't drank a Corona in 14 hours. And neither will you after this video. Landshark and Heineken, not affiliated, not a sponsorship. Lastly, do you have children, America? I bet some of you do. Are you worried about Johnny and Susie running to school, playing with toys? Well, guess what? We were too. And you know what? We've even taken steps to protect, I'm going to go ahead and say it, America, their toys. Do you think I want Berenstein Bear getting the freaking coronavirus, world? Never, never in my time will this baby bear be affected with corona. Not on my watch. Not on my watch. So is this to say that this pandemic is going to get you? Well, it could. But if you watch this video and you take these steps seriously, America, and you go on the World Health Organization and read that 80% of people don't even know that they had the virus or experience these mild symptoms, runny nose, you will be safe. And this is Dr. Cherry Potter, protecting you, your family, and the world. We love you. All right, so in all honesty, the coronavirus, people are panicking. It is just a virus, people. Obviously, I was making a joke. This is actually from the World Health Organization. I'm not making it up. 80% of people recover from the disease without even having treatment. The people who this is actually affecting are people who are old, have numerous complications or comorbidities, okay, or are immunocompromised, like someone who's got pneumonia or actively has cancer, and they come upon this. Of course, any virus can be deadly, okay? But for the most part, you need the camera. For the most part, if you want to get him. For the most part, this disease is completely fine. All right, so just go to the CDC, go to the WHO, find out how you actually treat this. The number one thing you do, wash your hands. Don't go out. Do not go out into the public if you feel like you've got the sniffles and that you might have the coronavirus. Obviously, don't go out and affect a bunch of people. Don't go to gym class, okay? Use common sense. Wash your hands, use Germ-X, use a tissue. Don't lick your finger, don't touch your eyes, don't touch your face because you might have touched a doorknob that had a virus on it, just like 90% of viruses are, okay? So, obviously this was done in jest. I know people are sick out there and being infected, but I think it's ludicrous that people are freaking out about this virus when what it is, if you go and look on the WHO's website, you can see that almost over 80% of people don't even know they have it, or they have a little runny nose, maybe it's mild fever, and they have some diarrhea, just like any other virus, okay? So just go out there, be informed, don't panic, don't wait in Costco's line for 40 years. Wash your hands. We love you. Bye.